Now the clinical feature of acne vulgaris. In the patient who having the acne, that person having the oily, greasy face and multiple opening, you can see on the face, multiple opening or a pores. That is also known as patulous follicular opening.
Yes, बहुत सारे लोग आते हैं कि सर मेरे ओपन पोर्स है, उसका कुछ करो, तो उसके लिए कुछ नहीं होता है.
And now the manifestation of acne vulgaris is polymorphic, means eruptions are seen different variety in the same skin. Like you can see the papules, pustule, nodules, cyst, and the pathogenomic means the characteristic of acne vulgaris is open or the closed comedones and with the oily skin. This is the characteristic for identification of acne vulgaris.
Now, let me explain you what is open pore that is mentioned later.
Yes.
Yeah. Yeah, this is the case of acne vulgaris.
You can see the multiple different types of eruptions. Some are nodules type, some having the pus. Here you can see the pus. Some having the papules, and in this closer view, you can see the comedones also. Here the closed comedones, here the whiteheads. So multiple different varieties of eruptions means polymorphic kind of eruptions are seen in acne vulgaris. Here is the acne on the chin. Generally on the chin area, the person who used the more cosmetic product, in those patients, you can see the acne in the chin region.
और acne in chin के अंदर भी wonderful remedy that is viola tea. हाँ जी. Ethiolum. Ethiolum तो हम use नहीं करते, लेकिन viola tea acne on chin, guys. I have used first time in one MD physician when he came to me with acne on chin. उसको सिर्फ chin के ऊपर acne हो रहा है. And I use viola tea that works excellently. So कई cases होते हैं that lead us to the frequently use of such medicine. So that was the case कि वहां से मैंने viola tea use करना शुरू किया, and guys it works. Acne on chin.
So after this session, when the patient come with acne on chin, so you have to ask about the cosmetic history. If they are using certain cosmetic product which containing the oil, so you can identify that also.
बोलो कि change करे आपका product.
And change and shift to the water-based product. Here is the acne vulgaris on a back. Here you can see the multiple different kind of eruptions that not look alike to each other. You can see the pustule, the blackheads, and papules, and here there's some cystic kind of eruptions. So by which you can identify the case of acne vulgaris. Now the comedones. So comedones are the pathogenomic, means the characteristic of acne vulgaris. So what are comedones? Generally, they are of two types. First is open comedones and second is closed comedones. And third is also there, that is submarine type.
Submarine, yeah.
Here is the picture. This is open comedones, or generally we see it as blackheads. Here is closed comedones, we termed as whiteheads. And this is the submarine kind of comedones, which are deep-seated. Here the superficial comedones are superficial. Here the some layer of skin are appear, and this is closed comedones.
So the submarine comedones are quite difficult to cure, guys.
They not
Quite
respond
difficult.
to the medicines.
Yes.
Now the open comedones is termed as blackheads. Generally what happen, then the comedones occur, the plugging of the pilosebaceous orifice. Here the pilosebaceous orifice, when clogged by the keratinous substance, then the blackheads are developed.
Yes.
But if the ductal area of the sebaceous glands are clogged by the keratinous substance and sebum, then it turn into the whiteheads.
जब भी if the pore is open and if it came in contact with oxygen, in those cases it creates black color. And if it is not coming to contact with oxygen and if it is remain closed, then it is remain whited. Are you with me, guys?
Yes, sir.
Yes, sir.
So the open comedones are generally the orifice are closed, and in the closed comedones, the pilosebaceous duct are clogged. Okay, now the submarine comedones are deep-seated into the skin. So we can see clearly after scratching the skin.
वो स्ट्रेच करके देखना पड़ता है. मेक अ हैबिट टू सी द पेशेंट ऑफ एक्ने. ऐसे चेक करो, और इफ इट इज नोड्यूल और नॉट, ऐसे प्रेस करके चेक करो. समटाइम एक्ने इज नॉट सीन आउटसाइड, वो नोड्यूल और एक्ने होता है तो अंदर की तरफ गांठ जैसा होता है. तो मेक अ हैबिट टू चेक विथ योर हैंड. ऐसे चेक करो. आपकी स्किन तो क्लियर है, मेरे में दिखेगा ऐसे.
And submarine comedones, as sir discussed ago, they are not respond well with the medical treatment. Now, when the acne leaves the skin and heals the skin and then leave the scarring. Now, the scar are of a two type, generally the depressed scar and hypertrophic scar. Depressed scar means they create a pit on the skin or someone's shrunken type of appearance on the skin. A depressed scar are of a three type: ice pick scar, box scar, and rolling scar. And hypertrophic scar are generally raised and elevated thick bump, which termed as a hypertrophic scar. And some in extensive cases of acne vulgaris, like acne conglobata, like we discussed in further. In that cases, the keloidal scar are developed. So what is the difference between hypertrophic and keloidal scar? Hypertrophic scar are generally seen in the area where the acne appear, and keloidal scar are developed beyond the area of eruptions. Hypertrophic scar generally heals with the time, where the keloidal scar are never regress. Here some picture. This is the rolling scar. The rolling scar forming the pit like a round shape, and that appears superficially like this.
And this is the box scars.
Yeah.
You can see over here.
Generally, the box scar are developed in acne vulgaris. So the box scar are superficial, or in some extensive cases, they are deep. Ice pick scar are the deepest scar, and where that this type of scar are very difficult to treat even with the dermatological treatment.
Yes.
Like microneedling or the resurfacing or the CO2 laser treatment.
So what is the remedy we have for scar acne? Anyone? Acne scar. Any remedy you know?
Calibrom.
Yes. Where it is mentioned?
In Ellen keynote.
दिखाओ.
Yes, sir.
निकालो wait, Ellen. For example, फाटक निकालो. That is mentioned in फाटक. That is mentioned in acne. The in keynote. Calibrom निकालो. That is for keloidal. वो आ रहा है.
Yes, sir. In skin acne simplex indurata, rosacea, bluish red pustule on face, chest, shoulder leaves unsightly scars.
Yes.
Even in carbon anomalous also it is present.
Yes, carboanomalies it is also mentioned. So we have two remedies, one is calibrom and one is carboanomalies. So from my side, calibrom is a typical picture of PCOS. Sub symptoms, whatever symptoms you have of PCOS, you can see in calibrom. PCOS वाले patient को जो scar हो रहा है, जो acne हो रहा है, you can think of calibrom. और फाटक में कहाँ लिखा है?
Scars remaining after eruptions.
Scar remaining after eruption. It is also mentioned in Pathak. Pathak nahi, Pathak. I was wrong. Yes, these are the scar. Scar के अंदर बहुत limited medicine है. Even dermatologists are not able to cure such scars sometime. As doctor said, के ice pick scar are quite difficult to cure. Yes, they are not able to cure sometime. That can be reduced with our routine medicine. And yes, box scar are not curable. They can reduce. The rolling scar with pigmentation sometimes get cured, but these are the thing which is not completely curable. And the fourth thing, that is hypertrophic scar, that is keloid. That is called as keloidal acne. That is called as cystic keloidal acne. So those are our wonderful remedy which respond good with such condition. कौन सी मेडिसिन आपके माइंड में आ रही है फॉर किलोइडल एक्ने?
Calcarea floor,
Yes, yes, Divya. One is calcarea floor.
Thiocinaminum.
Which one?
Thiocinaminum.
Yes, we can definitely think of this medicine, and that works excellently. Theosaninum, we are prescribing in 3x sometime, in 2x. If you get it in 1x, you can prescribe it in lower potencies. It works excellently in keloids, whatever it may be, the acne keloid or another form, that works excellently. Yes, acid floor is one of the good remedy that works in keloidal acne.
Next is side of predilection, means where the acne are
सर आपने कौन सी मेडिसिन बोली किलोइडल एक्ने के लिए?
Calcarea floor, theosaninum. Open theosaninum, guys. Open theosaninum in your boric. आपने लाइफ में थियोसाइनिनम पढ़ी हो ना, तो आप ऐसा सोचोगे कि होम्योपैथी कैन डू वंडर्स, लेकिन ऐसा नहीं है. थियोसाइनिनम और कहीं पे हेल्प नहीं करती है. Can anyone read it? Theosaninum from boric.
what is the scar tissue.
थियोसाइनिनम जो सब केस में काम करेगी ना, तो सर्जन की जरूरत ही नहीं पड़ेगी. Can anyone read it?
Thiocyaninum resolvent externally and internally for dissolving scar tissues, tumors, enlarged glands, lupus,
स्कार टिश्यू में भी
stricture,
काम करता है, ट्यूमर में भी काम करता है,
enlarged glands,
एनलार्ज ग्लैंड में भी काम करता है. फिर
lupus, strictures, adhesions, atrophy and opacities of cornea, cataract, ankylosis, fibroids, scleroderma, noises in ear suggested by Dr. A.S. Hart for retarding old age. A remedy for taps dorsalis improving the lightning pain. Gastric vesicle and rectal crisis. Stricture of rectum 2 grains twice daily.
ये सब सर्जिकल कंडीशन है जिसके अंदर थियोसाइनिनम वर्क करती है. लेकिन बिलीव मी गाइस, मुझे तो किलोइड में ही रिजल्ट मिलता है और कहीं पे नहीं मिला है. सो ये सब ऐसी ऐसी कंडीशन लिखी है विच इज कंप्लीटली सर्जिकल कंडीशन, तो उसमें थियोसाइनिनम वर्क करती है नहीं करती है पता नहीं है. लेकिन यस, यू कैन थिंक ऑफ दिस रेमेडी ऑलवेज फॉर किलोइड. किलोइड में तो ये काम करती ही है. एंड
किलोइड में सर लोअर पोटेंसी.
या लोअर पोटेंसी में यूज करो.
ओके सर, थैंक यू.
So even this medicine works in tinnitus. Tinnitus में भी help करती है. For that you have to use it in higher potency, 200 और 1 में use. Otitis media वगैरह में. और वो sensorial hearing deafness होता है, that might be mentioned. Wait, हाँ, deafness due to some fibrous change in nerve. तो जो सेंसोरियल हियरिंग डेफनेस होता है, देयर आर टू टाइप्स ऑफ हियरिंग डेफनेस, वन इज कंडक्टिव, वन इज सेंसोरियल. तो जो सेंसोरियल काइंड ऑफ हियरिंग डेफनेस होती है, उनके अंदर यू कैन थिंक ऑफ दिस रेमेडी, दैट इज थियोसाइनिनम. आर विद मी गाइस?
Yes, sir.
यस सर.
And the another remedy is acid floor. Acid floor is always there for keloids, so we can think of this remedy. Please.
Sir, can we apply the thiocyanamidum directly on the skin?
बहुत सारे डॉक्टर्स आर यूजिंग एक्सटर्नल एप्लीकेशन एज अ थियोसाइनिनम. मुझे पर्सनली रिजल्ट नहीं मिल रहे हैं, इसलिए आई एम नॉट यूजिंग. लेकिन बहुत सारे डॉक्टर्स यूज करते हैं, दे माइट बी गेट रिजल्ट. तो यू कैन यूज इट, नॉट एन इशू. उसकी टैबलेट्स आती है, तो पेशेंट को बोलो टैबलेट को पानी के अंदर डाइल्यूट कर दे, एंड देन ये दे कैन अप्लाई ऑन द स्कार, अप्लाई ऑन द किलो.
Okay, sir.
या एक्सटर्नली.
Generally, acne vulgaris is seen on the side like a face, especially on a face, forehead, cheek, chin, and in the shoulder, upper chest, and back region. If acne occur other than this side, so we can suspect is acne form is like occupational acne. Occupational acne generally seen on the forearm and in the region of the thighs and legs. So then we can suspect the occupational acne. Here is the site of predilection. Face, especially the forehead, chin, cheek, and the chest and back are mostly involved in acne vulgaris. Association means along with the acne vulgaris, there is seborrhea, means the greasiness, oiliness of the skin, and the multiple open pores. And other features like the hyper androgenism, like some patient having the issue of extra hair growth, virilism, irregular periods, weight gain in the certain periods. So in those patients, we can go for the androgen test and we can differentiate from the polycystic ovarian syndrome and other syndrome also.
बहुत सारे PCOS वाले पेशेंट हमारे क्लिनिक के ऊपर दे आर डायग्नोस्ड फ्रॉम एक्ने ओनली. एक्ने लेके आते हैं, उसके साथ साथ व्हेन दे हैव हर्सुटिज्म और उसके साथ जो मेंस्ट्रुअल इरेगुलरिटी हुई, देन यू हैव टू गो फॉर रिपोर्ट्स. इफ यू गेट these three things, always think of PCOS. PCOS कैसे डायग्नोस होता है? Anyone guys? Any criteria you know about PCOS? Any criteria?
Weight gain and menstrual irregularities.
Yes, that was a physical or clinical symptom. Then
Many investigations are also
sorry, Zahibia.
many investigations are also done. For example, FH to LH ratio, and then there is another.
Yes, that is called
So
as
there are two ways of diagnosing. One is through physical features and one is through laboratory investigations.
yes. So three things are there. One is clinical symptoms. Second is blood reports, and third is sonography. Among these three criteria, when there is positive into any two criteria, that we can label it as a PCOS. Otherwise, that is not a PCOS, guys. आपने reports करवाए, reports are absolutely normal, but PCOS is present in sonography. PCOS के symptoms are there, you can term it as a PCOS. But only clinical symptoms are there. Androgenic reports, FSH, LH ratio is normal, that sonography is normal, you cannot term it as a PCOS. That is, you can term it as a hormonal changes only. Right? Are you with me?
Yes, sir.
Here the virilism means secondary sexual characteristic of male is seen in female, that is virilism.
Yes.